Hello, this is Dr. Gay from First Look MRI, and this is a 55-year-old woman who has pain in the lateral ankle. She has a tear of her Peroneus brevis tendon, but that's not why I'm showing the case. I'm showing the case because of this. There's an area of fat here, and we see commonly in the foot and ankle fat collections like this. But just to get back to the Peroneus tendon tear, if you're wondering about that, this is the Peroneus longus tendon, more posterior. This is the calcaneus or the heel, Achilles tendon. And again, this is the Peroneus longus in back. In front, we have the Peroneus brevis. And it should look very similar to the longus, but instead it's enlarged, ill-defined, intermediate in signal. On this view here, we see two components. Here's an inner and outer component, so a longitudinal split tear of the Peroneus brevis. Here it comes back together. Here it splits apart into the two components. So the real reason I'm showing this is because of this little fat collection right here. It's very common to see in the foot and ankle loculations of fat. They look just like lipomas. They can be pretty clean. And so we really don't mention fatty collections as lipomas in the foot and ankle. And we see these things all the time. Sometimes people will feel a little bump, and it's hard to know, is this just a asymmetric fatty collection like this? You can see the subcutaneous fat here really thin, underlying muscle, and we come over here and all of a sudden, whoa, this big collection of fat that's fairly clean. And along on the medial side, they had another collection like this. Let me come on down. There it is. Right over here, this is a pretty common place to get a collection of fat that doesn't have the normal fibrous strands supporting stroma. This is just a big round collection. So I have seen some radiologists will say, hey, there's a lipoma here. But I've seen these so often in patients with no complaints that I think these are just asymmetric loculations of fat rather than lipomas. So here's one right here, so clean. You can see how different it is from the other ones. But if someone said this is a lipoma, there'd be no way to argue against them. But again, we just see this very commonly. And here's another collection here on the outside. It bulges out. So asymmetric adipose deposition, or I guess it could be lipomas that just are asymptomatic. And that's it. Thank you very much.